हेलो गाइस। तो कैसे हो आप लोग। टुडे आई विल टीच अबाउट डिफरेंट स्टेजेस ऑफ न्यूट्रोफिलिक डेवलपमेंट एंड आल्सो सम अदर WBCs. So get ready. Let's start. The initial most stage of neutrophilic development is myeloblast. Okay. Then next stage is promyelocyte. Then next stage is myelocyte. Next stage is metamyelocyte. And the last stage is matured form. Okay, before maturation this is band form. Okay, these are the five stages you have to remember. Okay. Now you should remember that the nucleoli are decreasing as we are going down. Okay, so in myeloblastic stage nucleoli is absent, and mitosis occurs also up to myelocytic stage. Okay, so in metamyelocytic stage there is no mitosis. There is no mitosis. So from myeloblast up to myelocyte, this is called the mitotic pool. Okay, this is called the mitotic pool. So normally neutrophils require 10 days for their maturation. So and in the mitotic pool there are two pools. One is mitotic pool. In mitotic pool they will remain for 5 days. Okay, and in the maturation pool, that is from the metamyelocyte and band form up to band form, this is called the maturation pool. This maturation pool, and they remain in maturation pool for 5 days. Okay, so you should remember that. Now in the myeloblastic stage there is no specific granules. There are no granules. Okay, no granules. Now primary granules appear in promyelocytic stage. Primary granules, and also in myelocytic stage these primary granules disappear and secondary granules appear. Okay, secondary granules appear. And also in the next stage, in the myeloblastic stage there are no granules. In the promyelocyte there is primary granule. In the myelocyte primary granules disappear and secondary granules appear. In the metamyelocytic stage specific granules appear. Okay, specific granules, and the specific granules persist in band form also. Okay, in band form also specific granules persist. Now what are the contents of these granules? Okay, no record to memorize this, but primary granules contain mostly proteolytic enzymes. Okay, primary granules contain mostly proteolytic enzymes. And secondary granules contain mostly vitamin B12 binding proteins and lactoferrins. Okay, secondary granules, vitamin B12 binding proteins, lactoferrin. Okay, so these are the different contents of primary granules and secondary granules. Now what next? Now a very important topic in neutrophilic inflammation. What are the different cellular events and what are the different vascular events? Okay, so first, inflammation. What are the four hallmarks of inflammation? Okay, This is a repeatedly asked question. What are the different hallmarks of inflammation? There are four. Okay, you have to remember four of them. They are calor. Calor signifies heat. Okay, rubor. It signifies redness. Tumor. Tumor signifies swelling. And then dolor, that is pain. You have to remember all of them. Now, what are the different events during inflammation? What are the vascular events? Vascular events of inflammation. First, there is transient vasoconstriction. Next stage is vasodilation. Next stage is increased vascular permeability. Due to increasing vascular permeability, different fluids, toxins, chemicals, proteins, these are coming into extravascular space. Okay, these are coming into extravascular space. They move into extravascular space, and this is they are called exudates. Okay, exudates. These exudates are cleaned by lymphatic system. We all know that from the extravascular spaces, from the interstitial spaces, there are some lymphatics that are draining out the fluid. Okay, so lymphatic drainage. Sometimes this exudates, we all know when does inflammation occur. Inflammation occurs during any infection, when there is infection. Okay, it can be viral infection, it can be bacterial infection. Okay, so different types of infection, there is inflammation. So in inflammation there is first vasoconstriction, there is then vasodilation. जब vasodilation होता है, then next stage is increase in vascular permeability. Now as there is increase in vascular permeability, different types of substances like fluid, toxins and proteins come out. These are called exudates. So you think as there is infection, the exudate can contain infectious particle. Okay, they can contain infectious particle. Infectious particles. This infectious particle can call lymphatic infection. This is called lymphangitis. Okay, lymphangitis. As they are drained by lymph, so it can cause lymphangitis. So these are the all vascular events. Now, what are the cellular events? Now there are two types of killing of bacteria. Okay, so let me draw a blood vessel. Okay. These are the endothelial cells. Okay, endothelial cells. Endothelial cells. So neutrophils, we know that the formed elements are present at the center. Okay, formed elements of blood are present at the center. Suppose this is a neutrophil. You remember formed elements of blood, they are present at the center. Okay, so suppose there is a bacteria that is outside. Okay, so to engulf the bacteria, that first the neutrophil has to come outside. So what are the different stages of neutrophil coming outside? First, to come outside through the endothelium, यहाँ पे जो न्यूट्रोफिल है वो सेंटर में है, तो बाहर आने के लिए इसको मार्जिन में आना पड़ेगा. सो द फर्स्ट स्टेज इज मार्जिनेशन. ओके, now as it is coming towards the endothelium, at the edge of endothelium, the next stage is we all call is adhesion. Okay, what do you call adhesion? sorry, not adhesion. The next stage is rolling. Okay, rolling. Now what is rolling? Rolling is basically the transient attachment and detachment between neutrophils and the endothelial cell. Okay, it is the transient attachment and detachment of neutrophil and endothelial cells. Okay. Now, on the surface of neutrophils, there are some receptors called silyl Lewis X receptor. Okay, silyl Lewis X receptor. Cell Lewis X receptor, and on the surface of the endothelial cell, there are also selectins are present. Okay, selectins are present. Selectins are present on the endothelial cell. So here neutrophils, these are receptors, and on endothelial cells, this is neutrophil, this is endothelial cell, and these are selectins. Okay, selectins. So you can see there is transient binding between the Lewis X receptor of the neutrophil. न्यूट्रोफिल में क्या है? लुईस एक्स रिसेप्टर. एंड सिलेक्टिन्स कहाँ पे है? एंडोथेलियल सेल. इसको कंफ्यूज मत करना. तो देयर आर 3 टाइप्स ऑफ सिलेक्टिन. वन इज ई सिलेक्टिन, दिस इज प्रेजेंट ऑन द एंडोथेलियम. पी सिलेक्टिन, प्लेटलेट्स, and L-selectin. Okay, the L-selectin does not play important role in inflammation. Okay, so there are three types of selectin. Now P-selectin is present in a special kind of bodies called Weber palette bodies. Okay, no need to remember that. Weber palette bodies. Now Weber palette bodies also contain Willebrand factor. So this Weber palette bodies also play an important role in rolling. Okay, this rolling phenomena. Okay, this is the rolling. Second, this is the explanation of rolling. Okay, so the next stage is adhesion. Previous stage there were transient binding. Now there will be firm binding. Okay, firm binding. Now neutrophil में previously कौन था? लुईस एक्स रिसेप्टर. नाउ न्यूट्रोफिल में कौन है? इंटीग्रीन्स. ओके, इंटीग्रीन्स. ओके, एंड एंडोथेलियम में बाइंड कौन कर रहा है इंटीग्रीन से? ओके, कैम्स, सेल एडहेशन मॉलिक्यूल. नाउ देयर आर 2 टाइप्स ऑफ कैम. intracellular and vascular cam. Okay, so यहाँ पे बाइंडिंग हो रहा है between integrins and cam, and this is a high affinity process. So this is a high affinity process. Okay, now the next step is diabetes. Okay, diabetes. देखो पहले सब एक बार रिवीजन करा देता हूँ. पहले हुआ आपका मार्जिनेशन, जो सेंट्रल में था वो मार्जिन में आ गया. इसके बाद हुआ रोलिंग मतलब ऐसे रोल कर रहा है, रोल करते जा रहा है. दिस इज ट्रांजिएंट अटैचमेंट एंड डिटैचमेंट बिटवीन न्यूट्रोफिल एंड एंडोथेलियल सेल. ओके, इसके बाद हो रहा है एडहेशन, मतलब पहले रोल कर रहा था एंडोथेलियल लाइनिंग के ऊपर, जो न्यूट्रोफिल है वो ऐसे रोल करते जा रहा था. अब वो एकदम फार्म एडहेशन हो गया. आफ्टर फार्म एडहेशन नाउ इट हैज़ टू कम आउट टू अफेक्ट बैक्टीरिया. यहाँ पे बैक्टीरिया है ना, देखो बैक्टीरिया को ख़त्म करने के लिए इसको बाहर आना है. ठीक है, इसको बैक्टीरिया को ख़त्म करने के लिए बाहर आना है. सो द अल्टीमेट प्रोसेस इज डायबिटीज. Neutrophil secretes some molecule called collagenase. Collagenase destroys basement endothelium, destroys basement. Okay. And also there is another molecule called PCAM. This is also kind of cell adhesion molecule. This also play important role in diabetes. So as it has come out, ठीक है, अब न्यूट्रोफिल क्या हुआ, ये जो बेसमेंट लेयर है उसको क्रॉस करके बाहर आ गया, ठीक है. अब यहाँ पे न्यूट्रोफिल, यहाँ पे बैक्टीरिया. दिस इज न्यूट्रोफिल, दिस इज बैक्टीरिया. नाउ टू मूव टुवर्ड्स द बैक्टीरिया, इसको क्या करना है, इट हैज़ टू डू अ यूनिडायरेक्शनल मूवमेंट टुवर्ड्स द बैक्टीरिया. ओके, दिस इज कॉल्ड द chemotaxis. Chemotaxis is the unidirectional movement of neutrophil towards the bacteria. Now, what are the exogenous chemotaxins? This is bacterial peptides. Bacterial peptides are exogenous chemotaxins. Exogenous मतलब बाहर से ना, exogenous chemotaxin. This is bacteria's own product, not body's product. Okay, chemotaxis. Taxin. Now, what are the endogenous? That is body's own products. Endogenous. No, endogenous chemotaxin can be different types. It is mostly C5A, leukotriene B4. Okay, leukotriene B4, leukotriene. Okay, leukotriene B4, and also interleukinate. These are all endogenous chemotaxins. Okay, leukotrienes. This is leukotrienes. Okay, leukotriene. Okay, leukotriene. So this is endogenous chemotaxis. Now the next step is recognition. Now neutrophil recognizes bacteria with the help of different types of carbohydrate molecules, mainly mannose. Okay, can be mannose. It can be other types of like sucrose, any other kind of carbohydrate molecules. Okay, because it contains a recognition receptor. Neutrophil has some recognition receptors. Now the next stage is engulfment. अब न्यूट्रोफिल को बैक्टीरिया को एनगल्फ करना है. सो वी ऑल नो न्यूट्रोफिल कंटेन्स एक्टिन मॉलिक्यूल्स. ओके, एक्टिन मॉलिक्यूल्स. न्यूट्रोफिल कंटेन एक्टिन मॉलिक्यूल्स. दिस एक्टिन अंडरगोस पॉलीमराइजेशन. एक्टिन मॉलिक्यूल्स अंडरगो पॉलीमराइजेशन. नाउ ड्यू टू पॉलीमराइजेशन दे फॉर्म स्यूडोपोड्स. ओके, स्यूडोपोडिया. आपको पता था ना, जो बैक्टीरिया अपना जो ईटिंग प्रोसीड्यूर है वो और माइक्रो ऑर्गेनिजम्स स्यूडोपोड फॉर्मेशन करके वो खाती है. सो सिमिलरली न्यूट्रोफिल्स ऑल्सो फॉर्म स्यूडोपोड्स टू ईट अप द बैक्टीरिया. ओके, ऐसे न्यूट्रोफिल ऐसे बैक्टीरिया ये स्यूडोपोड लेके बैक्टीरिया को अंदर घुसा लेता है. ओके, द स्यूडोपोड फॉर्मेशन इज कॉल्ड एनगल्फमेंट. नाउ नेक्स्ट द मोस्ट इंपॉर्टेंट स्टेज इज कीलिंग. ओके, कीलिंग. There can be oxygen dependent killing and oxygen independent killing. Okay, oxygen dependent killing is the one that you have to know. Okay, oxygen dependent killing. Now oxygen dependent killing is basically what happens, H plus and O2 plus NADPH in the presence of NADPH oxidase, they form superoxide anion. Okay, superoxide anions. This superoxide anions in presence of superoxide dismutase, they form hydrogen peroxide. Now this hydrogen peroxide in presence of myeloperoxidase, it forms HOCl mostly. This is the most powerful bactericidal agent. Okay, most powerful bactericidal agent. Most powerful bactericidal agent. Okay, so this is how the bacteria is killed, and this is the whole story of inflammation that I have taught to you. Okay. Now I should discuss about some others or some disorders. Okay, if NADPH oxidase is absent, okay, if there is no NADPH oxidase, we call the disease chronic granulomatous disease. Chronic granulomatous disease. Now, in chronic granulomatous disease, as there is absence of NADPH oxidase, so infection by catalase positive organism is the major concern, like staphylococci. So infection by catalase positive organism is a major concern. And also in chronic granulomatous disease, how do you detect it? You detect it by a test called NBT test, nitroprotetrazoleum test. Okay, and also flow cytometry. Okay. The next disease is there is absence of superoxide dismutase. If there is absence of superoxide dismutase, what will happen? The superoxide anions will accumulate. Okay, this can cause different peroxidation reactions. That is also harmful. So, in case of absence of superoxide dismutase, we call the disease as the disease is called amyotrophic lateral sclerosis. Okay, the disease is called amyotrophic lateral sclerosis. If superoxide dismutase is absent, it is called amyotrophic lateral sclerosis. And if myeloperoxidase is absent, there will be recurrent infections. Nothing to talk about that. Okay. This sums up all about the neutrophil. And another important topic I like to teach you is neutrophilic extracellular traps. Okay, and NETs, neutrophilic extracellular traps. Now, what happens is there is an enzyme called arginine deaminase. It converts arginine into citrulline. Now, this conversion of arginine into citrulline, it basically decondenses the chromatin. Okay, suppose this is the chromatin of the neutrophil, it decondenses the chromatin. Okay, now as it decondenses the chromatin, different type of hydrolytic enzymes are also released in the net. Different types of hydrolytic enzymes. Okay, hydrolytic enzymes. These hydrolytic enzymes kill the bacteria and prevent the spread of infection. Now, arginine deaminase causes the decondensation of chromatin. These chromatin are getting exposed. There is hydrolytic enzymes killing bacteria, prevent the spread of infection. Okay, but as the nuclear antigens are getting exposed, क्या होता है, जो न्यूक्लियर एंटीजन होता है वो छुपाए रखा होता है ना, क्योंकि न्यूक्लियस के अगेंस्ट अगर हमारा बॉडी कोई एंटीबॉडी फॉर्म करना शुरू कर देता है तो ऑटोइम्यून डिसऑर्डर हो सकता है. सेल्फ जो बॉडी का न्यूक्लियस है उसके अगेंस्ट ही एंटीबॉडी जनरेट हो रहा है. सो न्यूक्लियर एंटीजन इज नॉर्मली हाइडेड फ्रॉम द external immune system, but here the nuclear antigens are getting exposed, so there will be formation of anti-nuclear antibody. Okay, there are chances of formation of anti-nuclear antibodies, and as there are chances of formation of anti-nuclear antibodies, there are chances of autoimmune disorders. Okay, so this sums up all about the neutrophil. Now I'll try to discuss about eosinophils. Okay, eosinophils. Eosinophils are the most important weapon against the parasites. Okay, the most important protein that eosinophil contain is the major basic protein. This major basic protein basically kills the parasites. Okay, kills parasite. mostly anti-larvicidal. There are also two other proteins. These are basically cationic protein, major cationic protein, and eosinophil peroxidase. Okay, other two protein are major cationic protein and eosinophil peroxidase. These are basically anti-helminthic action. Okay, anti-helminthic action. Helminths action. Anti-helminths. We all know helminths. Okay, so anti-helminthic action. Now eosinophils play a very important role in type 1 hypersensitivity reaction. Type 1 hypersensitivity reaction. In allergies, they also release histaminase and aryl sulfatase B. Eosinophils release histaminase, aryl sulfatase B. Histamine is responsible for bronchoconstriction. So histaminase basically cleaves histamine, and basically they prevent the mast cell degranulation, and basically there is termination of effect of histamine. Okay, now ACTH causes eosinopenia. ACTH decreases the amount of eosinophil in our body. So these are all what you have to know about eosinophils. Okay. And morphological things you have to learn in practical. Now I will try to talk about some reticuloendothelial system. Okay, reticuloendothelial system. Now reticuloendothelial system, the macrophages of our body are the major components of reticuloendothelial system. Macrophages. Now macrophages are the most important component normally the monocytes. When the monocyte that have been formed, they are in circulation. Okay, they are in circulation. So they basically are called monocyte. Now as the monocyte enters the cellular components, they are called macrophages. Okay, so in liver, these macrophages are called Kupffer cells. This Kupffer cell help in killing the microbes. Killing microbes that basically come from the GIT. Coming from, we all know in the intestine there are a large number of common cells which can also potentially sometimes cause harm. So killing microbes coming from GIT. In brain, these are microglia in brain. The splenic macrophages are called littoral cells. They help in destroying RBCs. Alveolar macrophages clears the alveolar mucus from the dust. Okay, alveolar macrophages clears dust. Okay, and also there are also some macrophages in the bone marrow. Okay, in the bone marrow there are macrophages that eats up the basically destroyed RBCs. Okay, so this is all about reticuloendothelial system. Thank you guys. Okay, this is all that will be important for your examination. Okay.